Hi, Sylvain from Mancuso Clinic. This morning, I wanted to do a video about. I went to Australia for a seminar, and one of the doctor was there doing a presentation, was talking about chronic inflammation and how chronic inflammation can increase the risk of illness. And when he did this video, he used this schema where you have the chronic inflammation here. There. And this chronic inflammation is going to increase the risk of illness in many different things. But how we can understand chronic inflammation? And chronic inflammation is a low level of inflammation. If you go to do blood tests or anything like that, when they will check your blood result, they will not see a high level of protein showing the inflammation. But this low level of inflammation is going to increase the risk of illness. As you can see, you can have fatty liver, diabetes type 2, cardiovascular issue, cancer, and yes, inflammation is one of the precursor of cancer. It's what thermography is so interesting, and you can go on our website to check the thermography clinic where they are looking at the pre-inflammation, and the inflammation gave us a lot of information about maybe a cancer coming. Depression, autoimmune disease, and I really want to talk about this because autoimmune disease is when your body is going to begin to attack your own body. Then, multisclerosis is the type of autoimmune disease. And this type of issue often come when the inflammation is always too high and at what time you are going to trigger. Inflammation can have a lot of effect on neurodegenerative, and a study showed that recently pro-inflammatory bacteria were in the gut of the mother was able to give Alzheimer to the baby, and it was for mice. But the idea is the presence of the certain type of pro-inflammatory bacteria can increase the risk of Alzheimer disease. And osteoporosis, then fragility when you begin to old. The funny part in that is many people were saying, oh, when you have osteoporosis, it's good to take milk. But milk is inflammatory for your body. We are not made to drink milk at the adult age. This inflammatory protein of the casein in the milk is going to increase the risk of inflammation and increasing the risk of osteoporosis. Drinking milk to reduce osteoporosis is not doing the job. If you ask, go to see your nutritionist like Shelly Leger, who is working with us. She will give you some specific advice to help you to increase the strength of your bones and reducing the risk of osteoporosis. And immunosenescence is the reduction of your ability to fight disease. But okay, we know that this chronic inflammation can give all these different type of disease. Fine. But what can we do to reduce this risk of disease? And it's pretty simple. There, we are going to go there. For me, the health is around three main things: activity, diet, and stress. But if you look at this, we can see that we can definitely improve small things in our everyday habit to reduce the risk of chronic inflammation. The first one, we are going to talk about diet. When we talk about diet, we talk about pro-inflammatory food like processed food, dairy product, or sugar. But what we can integrate to reduce the inflammation in your body with your diet. Eat more whole food, omega-3 fat fish, like salmon or this type of things, and to increase the um, intake of omega-3, but at the same time, sometimes it's better to take omega-3 like oil or pills because the quality of the omega-3 in the some of salmon is not always good. The balance between omega-6 and omega-3 can be completely unbalanced in the fish and increase the risk of inflammation. It's why wild fish it's way better than the one uh, in farm. Other things about the diet is vegetables for sure. Avocado, for example, is going to reduce the risk of inflammation. And we have on Mancuso Clinic a specific program about anti-inflammatory food if you are interested. But the first thing for me is to reduce the intake of inflammatory food like dairy product, um, uh, milk, dairy product, milk, processed food, and sugar. The other things I think are pretty related is physical activity, inactivity, and obesity. The study showed that you don't really need to go to the gym and run like crazy on a treadmill. Low or medium intensity exercise can make the job to create a good blood flow in the system and reduce the risk of chronic inflammation. When your body is working, is helping to clear the body, removing all the toxin, and from that, you will reduce the risk of inflammation. Chronic infection like flu or this type of things who can increase the risk of inflammation, but you can see that it's not only one thing who is going to increase the systemic chronic inflammation, is all the small things. And be able to work on each level of this inflammation, I think, can make a huge difference. Your probiome is really important. A study recently showed that what you think can change the type of bacteria you have in your gut. And these bacteria, it was about people who are suffering from discrimination. And in this study, they showed that when they analyze the stool of these people, they see that because of the stress, it was changing the uh, the probiome in the system and changing the probiome in the system. And from that, the probiome was changing to a pro-inflammatory bacteria. And just analyzing the stool, they have 91% of efficiency to see who was suffering from discrimination and who was not suffering from discrimination. Then we can definitely see that the brain is working on the probiome. The other part is stress. Many study. There was a book called Blue Zone, and they were talking about stress management, but they are talking about people around you. Have a good friend or a lot of people around you with a good connection, a social connection, can help to reduce the stress. The last one of the other things we can talk about is your sleeping habit. When you sleep, sleep is a recovery time for your body, and have a better sleeping habit can reduce the risk of chronic inflammation. And the last one is the xenobiotics, is all the environmental chemical around you who can increase the risk of inflammation. Then when we look at that, we have a lot of possibility to reduce the chronic inflammation. We can work a little bit on each side, or we can focus on one. But for my opinion, the best way to tackle systemic chronic inflammation is to use diet, mindset, and physical activity. These three pillars of health will help you to reduce the chronic inflammation and will reduce the risk of chronic disease with arthritis and all that, because when you improve your physical activity level, your diet, and your stress, it will reduce the risk of chronic inflammation and reduce the risk of chronic illness, where you see that here. If you have any questions about how can I change my everyday life, or how can I do or implement in my everyday life to reduce the risk of chronic inflammation, you can contact us at mancuzoclinic.com and we'll be happy to help you. Have a great day.